बैकग्राउंड नॉइज वगैरह तो ज्यादा नहीं आ रहा है? फोन ऑफ करके देख ले क्या?
एक मिनट सर, एक मिनट।
चलो ठीक है, आ भी रहा होगा, अब क्या कर सकते हैं। चलो स्टार्ट करते हैं, लाइव कर दो।
ओके,
डन। Hello, my dear friends. A very good morning to all of you. Um, my name is Dr. Ashwani Ranjan, and I have done my MBBS from Aligarh Muslim University, my MD in Preventive Social Medicine from AIMS New Delhi, and I'm teaching preventive social medicine for last many years with some fixed purpose in my mind. One of my purpose of teaching is that we all know this PSM as a boring branch of MBBS, but I want all of you to feel and realize this, that PSM is an impactful branch. It has the power to change the life of poor people living in slum areas and rural part of India. And second thing is that PSM is also interesting, and so it is not important. It is impactful. We fall in love with our learning process. We all fall in love with our notes, our study. Then any exam will not be difficult, and we will enjoy our life very well. So I just want to develop some love in your heart also for study, if possible. And the third purpose is that this class which we are going to take in any NEET exam or INICT exam, at least 95% questions should be from the class, from the notes which we are writing directly. Okay, so this is the three purposes with which we are learning. And you are post intern batch, so you already know that in PSM we have what are the various topics which we have to study. So is there any topic with which you want me to start? Any topic which you think is very important and you want me to start, you can let me know. Otherwise, we can also go with the flow, and we can start with the topic that we had pre-decided, that is the so-called most difficult topic of PSM biostat. And I choose this topic first because of two reasons. One reason is you are post intern batch, and you have the basic knowledge already. Second reason is that we think it is difficult, so let's tackle the difficulty first, and then the other part will be definitely simpler. And it's not difficult. I will make you feel that it is not simple. So we will first discuss the concept, then we will discuss around 10 questions from this concept of p-value, null hypothesis, alpha beta error, and what are the questions that came in recent last 7-year exams. We will discuss those. Okay, so let's continue the discussion with the topic of biostat, if you are okay with that. If you want to learn any new topic, don't hesitate and let me know in the chat box of Telegram group what you want to learn. So in biostat, again, the first thing is that all of you will do some study in your PG, whether you take surgery, medicine, any branch. So for any study, for any research, we all do 4 steps. Okay, there are fixed 4 steps of all the study. For all study or for any study, there are the same step. The first step is that when we start the study, we start by creating a null hypothesis. So that is the first step, to generate null hypothesis. And this null hypothesis is a very simple thing. It simply says in the beginning that the new treatment or the new drug is not significantly different than previous treatment or previous drug. Because no two things in the world are exactly same. Even twins brothers and twin sisters also have some differences. So of course new treatment is different than previous treatment. Everything is different, so they will be also be different from previous treatment or previous drug. But the difference is not big. The difference is very small. It is not significant. Okay. So this is the beginning of the study when scientists say that his or her new drug is null, is null, is of no use. है ना? And the scientists say that if any difference came between the new drug and the older drug, if any difference came between new drug and previous drug, between new study and previous study, it is just due to random factor between new drug and previous drug or new study and previous study. It is due to random factor. The difference is not significantly. Okay, the difference is very small. For example, uh, let's say any coaching institute, let's say dams or Bhatia is saying that, let's say Bhatia is saying that we are better than dams. Okay, so in the first step, if they want to prove that they are better than dams, the first step is that they will give null hypothesis, and null hypothesis will say that the two coaching institutes are same and the difference which is coming is due to random factor. The difference is not significant. Okay, so similarly, suppose let's say Arman want to found a new drug for obesity. So in the beginning, Arman will say that his new drug for obesity is same as Orlistat. It's same as previous drug. And if any difference came between the new drug developed by Dr. Arman and the previous drug of obesity, that difference is just due to random factor, just by chance. Okay, it is due to random factor or by chance. Okay, any difference which came is by chance. Okay, so of course, if Arman has developed the new drug to treat obesity, he would never like to prove that his new drug is same as old drug. All the scientists, they want to reject null hypothesis, because null hypothesis means their new drug, their new study is not useful. So all the scientists, all the researcher, they usually want to reject null hypothesis. So if they want to reject null hypothesis, why they are giving it? The reason why they are giving it, because in the beginning, if they say that my drug is better than the previous drug, it means they are biased from the beginning. So in the beginning, they say my new drug is same as previous drug. Any difference came, it is due to random factor, so that they look unbiased. Just to show off that we are unbiased, we are open to everyone, they say this line. But in the end, they always want to reject null hypothesis. Okay. For example, let's say a boy uh, proposed a girl, and after mm, a lot of hesitation, he proposed. But suppose the girl said that I have not seen you from that angle. You are same as other friend. So the girl is giving null hypothesis. You are not different than other friends, and you are same, not significant. You are null. So of course, what the boy would like to do? The boy would definitely like to reject null hypothesis. And first thing, all the researcher they want to do is reject it and prove that they are significant. So this is the very simple first step, null hypothesis. In the second step, we pre-decide mistakes to be done in the study, because if Dr. Arman want to prove that his new obesity drug is good, he need to do a study to prove that. Okay, and whatever study you will do in your life, whatever exam you will give in your life, there will be some mistakes that will happen in the study, and some mistake is okay in life or in study. So we pre-decide that we will do alpha error, and it is usually decided as 5%. So we will do 5% alpha error, and we will do 20% beta error. Beta error is usually allowed up to 20%. Okay. What is this alpha and beta error? It is very simple to understand. Whenever you overestimate the result or overestimate yourself, that is alpha error. Overestimating the new drug or new study. Okay. It simply means that you are acting over smartly and you are forcefully proving your new drug better than the previous drug, when in reality your new drug is not different than the previous drug. Okay, that is alpha error, acting over smartly, overestimating. And just opposite of that is beta error. Whenever we underestimate ourselves and think that other people are more intelligent than me, it means we are doing beta error. So beta error is underestimating the result. Okay, underestimating the new drug or new study or new drug or new study. Or as I said, alpha error means chalu banna, acting over smartly. So beta error is just opposite of that. What is the opposite of acting over smartly? Chalu ka ulta, acting foolishly. है ना? So in beta error, the researcher act foolishly. Okay, and he says that his new drug, which is actually useful, is not useful. We can also define alpha error as false positive and beta error as false negative. Understanding the concept of alpha beta error is very important, because many times in exams they give confusing options and they ask you to identify which statement is correct for alpha error, which statement is correct for beta error. So try to understand the concept here. Alpha error simply means that forcefully means wrongly, है ना? Wrongly saying non-significant result as significant. If we are saying non-significant result as significant, this is alpha error, this is false positive. Let me explain it to you. For example, suppose you are in second year of MBBS, not studying at that time, and your father called you at around 10:30, 11, and he asked the same question which mostly our father asks: how is your study going on, my son? पढ़ाई कैसी चल रही है बेटा? And you are not studying at that time. Suppose in second year you are just enjoying your life, doing some party and all, but you said, I am studying very well. Sometime I spent 6 hours in library, sometime 8 hours in library, and the librarian was asking me, why don't you sleep here? So You said some lie. You said that I am studying too much. So what were you doing? You are acting over smartly. You are forcefully trying to prove that you are reading significantly, when in reality you are not reading significantly. In reality, your study hour is non-significant. Okay, but you gave for yourself a false positive report. That is alpha error. Okay, and one more example we can take to understand it better, like for example, this coronal study by Baba Ramdev. This coronal study was done on asymptomatic patient who don't had any symptom of corona. They were positive on RT-PCR, but they were asymptomatic patient. And it is written in the coronal study itself that the study is done on asymptomatic patient. So when you are doing the study on asymptomatic patient, then we cannot say that it will treat corona fever. It can make COVID positive patient COVID negative, but we are doing it on patients without fever. So we cannot say that coronal study can treat fever. But coronal study said that है ना, coronal treat corona fever. But actually saying this line that coronal is significant in treating corona fever or COVID-19 fever, this will totally be a forceful statement. This will totally be not correct because it was done on uh, asymptomatic patients, so it cannot treat the fever. So if you are saying this line that it is treating fever, it means you are saying non-significant coronal drug as significant. Okay, you are acting over smartly. Chalu ban rahe ho. So this is a simple thing, alpha error. We can learn more about it with more examples if you want. Let me know if you want to have more example of alpha error. So wherever, simple thing is, wherever you want to prove that your drug is useful but in reality is not useful, that means you are acting over smartly to prove your drug as good and you are doing alpha error. Okay, जब भी बेकार दवाई को काम की बोली जाती है तो अल्फा एरर होता है, जैसा कोरोनिल के साथ हुआ था या जैसा यूजुअली साइंटिस्ट रिसर्चर करते हैं. ओके, क्योंकि उनको कंपनी वाले पैसा देते हैं, तो दे प्रूव फोर्सफुली ड्यू टू गेटिंग मनी फ्रॉम द ओनर्स एंड ऑल दैट देयर ड्रग इज यूजफुल and they are doing alpha error. Now beta error, as I said, is just opposite of it. We can simply write beta error as false negative, or we can write it as uh, beta error simply means that saying a significant result as non-significant. Okay, of course you are doing a mistake here, and when you say non-significant, when it means you said that your new drug is negative, is useless, but actually in reality your new drug is significant. So you are giving a negative report falsely. आप अपने दवाई को बिना काम का बोल देते हो, जबकि मान लो एक्चुअली में आपकी दवाई काम की है. तो इसी को बीटा एरर कहते हैं. एक एग्जांपल से समझते हैं. मान लो, सपोज यू डिड whole of the today's class, and at the end of the class your father called you and asked that again the same thing, my dear son or daughter, how is the study going on? And you said that I don't know, the exam are highly unpredictable these days, I don't know how my study is going and all, and I let's see what will happen. So what you are doing is, first thing is you are underestimating yourself. Second thing, from 10 to 7 p.m. you have given good attention, try to remember the content in the class. So you were actually doing significant hard work. But you yourself said that I'm not sure of result, I am not doing significant work, I am non-significant, I am doing non-significant hard work. So it means you are underestimating yourself and acting as a foolish person doing beta error. Ideally, what you should have said, you should have said that today I studied for 9 hours, I gave my 100% in remembering the things taught in the class, and I am sure that if I keep improving myself every day, no exam, no result is difficult. So your father will say, wow, dealer ho gaye ho, huh? You are saying very positive things. So this is beta error. And we can take one more example of beta error. Suppose this Dr. Arman, he found a significant drug to treat obesity of people like me. Okay. So suppose there is a new drug which can treat obesity. Treat obesity significantly. Okay. And it is treating obesity significantly better than previous drug. Okay. And there is one very famous drug to treat obesity, Orlistat. Orlistat prevent fat absorption from the intestine, and then uh, this the unabsorbed fat goes away from there. Okay, so a new drug is treating obesity significantly better than previous drug. But suppose Dr. Arman said, researcher said that new drug is not significant, is not significantly better. Okay, so in reality it was better, but he said it is not better. So this is a simple example of underestimating the new drug, underestimating our own research. And this is a very good example of beta error. Oh, tube light, please. Okay, so let's this alpha and beta error I hope is clear to all of you. Let's move ahead after deciding this alpha and beta error. What is the third step of study? Let's study that. Okay, so just 1 second, let me turn on the light. So after deciding the mistake that can occur in the study, in the third step, all of us, when we will do study, in the third step, we will conduct the study. And the study can be RCT, can be cohort, can be case control. There can be different type of study. We will read that. All the different type of study, their differences and all. And after conducting these studies, we get the result. And result is obtained through computer by applying parametric or non-parametric test. So that is the reason why we read parametric and non-parametric test. And for example, chi-square test, unpaired t-test, paired t-test, these all are various tests which we apply on the data collected from the study. Okay, when you do a study, the data comes out, and on the data we apply these different tests. And it's very simple to understand that in which situation we will apply which test. After discussing this topic of p-value, alpha, beta error, we may go to parametric and non-parametric tests, and we may understand very easily that in which situation which tests are applied. Okay, so in the third step we conduct the study and we apply the test. After applying the test, we get p value. Parametric and non-parametric tests give us p value. It also gives us 95% confidence interval, and it gives us mean odd ratio or mean relative risk. Okay, so with the help of these three things, p value, mean odds ratio, or mean relative risk, in the fourth and final step we decide whether our new study is significant or not. We decide whether new study is significant or not. Okay, so this decision is taken uh, based on three things, not just p value. It is the decision is taken based on confidence interval, p value, and mean relative risk together. And this is again a very common question being asked this day, that which of the following studies show association, which of the following study is significant. We will read that also. Okay, so uh, these are the four steps which we do in any study, and I hope alpha beta error is clear to all of you. This is in the Telegram group. It is DBMC regular post intern batch. So I am in this batch. I am on the Telegram right now. If you have any doubt, any question from this part, please do ask freely in the group. Okay. So I think this four step is clear to you, and it's very easy to understand all this thing, alpha, beta error, and how to conduct a study. Because let's say, take example of that boy who expressed the feeling, and the girl said that you are just same as other boy, and you are following null hypothesis. So now the boy want to disprove null hypothesis, want to prove that I am significantly better. Try me, and I am better. So suppose to prove this thing, this student, he thought of conducting a case control study, and he asked it from all the seniors, all the batchmates who came after having a date. He asked the question that what happened in the date, how you propose the girl, what is the correct method of proposal and all, so that he may learn the technique and next time he can prove that he is significant. So suppose there is one senior who is doing alpha error. What is alpha error? This senior or this batchmate, he went on the date. The date was just so. The boy was not able to express himself, and they just had coffee and then they went back. But when the boy came in the boys' hostel, said that, ha, what can happen? The girl said, yes, no one can say no to me. And we had a kiss also, we had good time. So what the senior is doing here? The senior is in this case acting over smartly. He is forcefully saying that his non-significant date was significant. And he is forcefully saying that his date was positive when actually his date was not positive, not significant. है ना, but he is forcefully proving that his date is significant. तो ये फेंक रहा है ना, चालू बन रहा है ना, झूठ मूठ का अपना भाव बढ़ा रहा है ना. That is alpha error when you overestimate the thing. And beta error will be just opposite of it. Suppose your batchmate came from the date, and in the date he also got a kiss from the girl, like the date was completely good, very productive. Kiss on cheek, huh? Soft. Huh? So when this batchmate of yours came back after the date, and this new student who is doing case control study, he asked it from him, how was your date? So this second boy, he know that if I say that the date was successful, then the friend will pull my leg. They will take name of the girl and they will make fun of me at some. The girl, we just had coffee and she went. He said that the date was non-significant, but in reality, the date was significant. He also got the kiss. So whenever you are acting foolishly, whenever you are saying that the date was negative, non-significant, but in reality it is significant, it means you are doing beta error. Okay, so important to understand it because this decision whether the study or is significant or not depend on this thing, alpha error. Let me explain. See, this alpha error and p value have same meaning. They have same meaning, almost same meaning. And many a time in exam they ask this question also, that which of the following is correct for p value. So out of the four statements, the one statement where the researcher is acting over smartly and forcefully proving wrong thing as correct, that will be the correct option for p value, because this p value alpha error have same meaning. So you can simply find p value as acting over smartly. That is the correct for option for p value also. So what is the difference between them if they have same meaning? Why we are writing them differently? Because alpha error is pre-decided. When we start the study, we decide alpha error, and p value is something which is calculated at the end of study. So this is calculated at end of study. Okay. Now, suppose you are going to give a NEET exam or INICT exam very soon. So when you went to go give that exam, you pre-decided that I will do 5% mistake in the exam. I will attend 90% question and 5% I will do wrong. Okay, this is what you thought. You will do 5% mistake. But suppose at the end of study in the exam, you did only, let's say, 2% mistake, or you did just 5% mistake, the one which you had expected. You have pre-decided to do 5% mistake, and actually in the real exam also you did only 5% mistake. So it means, will you pass that exam or will you fail that? What does it mean? Will your result be significant or will your result be non-significant? Tell me. I think it's quite obvious that in any exam, if you do only 5% mistake or less than 5% mistake, it means you can be one of the top, or 5% is very less mistake. So in this case, result will be significant. क्या होगा? पार्टीज होंगी, बोतलें खुलेंगी, है ना, कोल्ड ड्रिंक की भी, it can be, but the result will be significant because you have done less mistake than expected. जितनी उम्मीद थी उससे भी कम गलती या उसके बराबर गलती करी है, तो इसका मतलब बहुत कम गलती हुई है, तो रिजल्ट को हम भरोसे लायक मानते हैं. Result will be significant when our final mistake p value is less than alpha error or equal to that. Okay, so कब result significant होगा? Result will be significant if p value is less than or equal to 0.05. Okay, बिकॉज 5% का मतलब क्या होता है 0.05। तो अगर 5% से कम गलती है तो रिजल्ट सिग्निफिकेंट होता है। ओके, और अगर रिजल्ट सिग्निफिकेंट है तो हम नल हाइपोथेसिस का क्या करेंगे? What will we do with the null hypothesis if the result is significant? Because null hypothesis say that result is non-significant. New drug or new medicine is not different than previous one significantly. है ना, result is non-significant. This is what null hypothesis says कि नई दवा null है, lull है, and you are getting that result is significant. So it means this null hypothesis, which is formulated in beginning of study, this is wrong. Okay, so if p value is less than or equal to 0.05, we reject null hypothesis, because in this case we are doing very less mistake, so our result is significant. And if our result is significant, it means null hypothesis formulated at beginning was wrong. And what we do with wrong thing? We reject them. Okay, so that's the thing we are doing here. Remember this very important point which came from this discussion, that if p value is less than or equal to 0.05, result of study or new drug is significant. Okay, because we have done very less mistake in the study, so we can say that the new drug is significant. And when the new drug is significant, then we always reject null hypothesis formed in the beginning of the study. Okay, are you getting it? How we decide this 5% as the limit? Because we allow 5% mistake. So if in the study the mistake is 5% or less than that, it means the study have almost no mistake. So we accept the study and we reject the null hypothesis. Okay, I hope it is clear, but please let me know. And if you want some more example of this thing, you can also ask it. Now, one more situation can there, that you pre-decided that you will do 5% mistake in the study in your INICT or NEET exam, but you did much more than that study. Suppose you did 20% mistake. Suppose p value came out to be 0.2. 20% mistake you did in the exam. Your expectation was 5%, you did 20%. Will the result be significant? Will you get very good rank in the exam? No, because you have done much more mistake than expected. So in this case, result will be non-significant. Okay, if p value is more than alpha error, result is non-significant, and we accept null hypothesis, because null hypothesis also say that result is non-significant, and we are also getting result as non-significant. So we will accept null hypothesis, we will accept that our result is useless. Okay, so please remember this line, the line being written above this part. This line is very important, and try to understand this concept completely. Okay, if you wish, we can have some more example, or we can have some more discussion on this topic. So do feel free to ask your doubt in the group. Let's understand these 4 steps which we are doing in the study with one very simple example that, let's say, suppose this Domino's Pizza, they said that we will give lifelong of free pizza to a person who proves that our pizza delivery is delayed. Okay, so suppose to get that offer, to win that competition, I thought to let's do the study, let's prove that it is delayed, and or you thought let's prove Domino's is delivering delayed pizza. So if we want to prove that, we need to do a study. And what will be the first step of that study? And the student says, sir, the first step will be to order the pizza. I said, you are right. But as a research wise, you have to prove it. And you just don't have to eat it, you have to prove it. So the first step is you will generate null hypothesis. And in the null hypothesis, you will say that my new study, new treatment or new study, my new study on Domino's is not significantly different than what is Domino's saying. My new study will also have pizza delivery within 30 minutes as claimed by Domino's. My study is same as the claim of Domino's that pizza delivery is not delayed. And that you will say in the beginning. And you will say in the beginning that in my study also the time of delivery of pizza will be 30 minutes or less. And I am doing it just for time pass. But what you actually want to do, you actually want to reject null hypothesis. You actually want to prove that Domino's is delayed, pizza delivery delayed. So that you can get free pizza, you want to reject null hypothesis. So suppose you want decided to conduct a study here, and you pre-decided alpha error 5%, beta error 20%. Now you conducted a cross. What is the time when you received it? Okay, so let's say you try to do a case control study on that, and you are asking past history of timing of pizza delivery. And some person, let's say let's say I called 10 people, and out of that 10, 8 friend replied. And those 8 friends, some are saying 30 minutes, some are saying 40 minutes, some are saying 25 minutes, some are saying 45 minutes. So when I combine the result of these 8 friends who replied to my question, suppose the combined result came 40 plus minus 5 minutes. Okay, so if it is coming 40 plus minus 5 minutes, it means it is taking more than 30 minutes. But did I won the competition? No, because to prove that it is delayed, I need to have a p-value less than alpha error. I need to have p-value less than or equal to 5%. So I put this data of 8 friend into computer, and I gave the command to computer apply parametric test, some test on this data. And after applying the test on this data, suppose p-value came equal to 0.05. So what does it mean? 0.05 means, did I won the competition? Did I prove that pizza delivery delayed? Yes. P-value is 0.05. It means study is significant. Study is significant means pizza delivery is delayed in my example. And when the study is significant, we reject null hypothesis, because null hypothesis said that pizza delivery is not delayed, and we are getting in the final result that pizza delivery is delayed. So it means the null hypothesis was wrong and we reject it. Okay, so after proving that pizza delivery is delayed, I went into the Domino's office running in excited mode, and I presented to them that, see, I have proven that pizza delivery is delayed. But suppose that Domino's have one biostat person sitting there also. He looked at my claim and he said, this is a fake claim. You are not going to get any pizza visa. I said, why, man? So the biostat person said that you will not get pizza because you have done alpha error in this study. Your study is not reliable. You have done too much alpha error. I said, what alpha error, man? What is mistake in my study? He said, see, there are two mistakes. First thing is that your sample size is very small. Only 8 friends you have taken. So there is very small sample size. And if the sample size is so small, we do not trust on the result of the study. Second thing is that you are giving us a data which is coming from history from your friend. Whatever your friend is telling, you are just writing it down. So the data is unreliable. Because suppose your friend know that you are asking this question to win free pizza, he can tell you a wrong delayed time. He can tell you that it came in 45 minutes, when in reality it came in 25 minutes. He wants you to win. So he will give you a fake history. So the data is unreliable and there is very small sample size. So it means you are forcefully proving. You are forcefully trying to prove that pizza delivery is delayed. This is what you are forcefully trying to prove. But in reality, it is non-significant. It is not delayed. So that is alpha error. When you forcefully prove something as significant, forcefully proving a study result as significant, when in reality it is not significant. Okay, forcefully proving significant when it is not significant. Okay, so I did not got any pizza. That is good for me. Otherwise I will look more fat and all, more. So this is the simple 4 step that we do in any study. And sometime, even when the p-value is 0.05 or less than that, even then we need to check that did we did too much mistake, are we doing too much alpha error. We have to check that. Okay, so I think this part of concept of alpha beta error, p value and null hypothesis is clear to all of you. Now let me ask some question to know whether this concept is completely clear or not. A question which came in exams previously. Let's start with a simple question. Let's say if p value came out to be uh, less than p value is equal to 0.022. Okay, then what will we do? Option A, we will uh, accept study result and we will accept null hypothesis. Accept means here we are saying that the study is significant. Okay, because we accept what is significant and we reject what is non significant. सच्ची बातों को एक्सेप्ट करते हैं, झूठी बातों को रिजेक्ट कर देते हैं. So what the same thing we are doing here also. So this is one option. Second option is we will say that we are reject study result and accept null hypothesis. Third option is accept study result and reject HO, reject null hypothesis. And last option is that we can reject both, reject study result and we can reject null hypothesis as well. So out of A, B, C, D, what is the thing which you will do if you got p-value less than or equal to 0.05? Like in this case, p-value is 0.022, less than or equal to 0.05. So which statement will be correct? A, B, C or D? Please try to give some answer and do not think whether your answer is right or wrong. In the class there is no wrong answer, and if you are giving a wrong answer it is much better, because when you give a wrong answer you will listen to the explanation carefully and you will do this answer correct in your main exam. Okay, so try to give some answer. Okay, I'm waiting for your answer for this question. Let me know what is your answer. What do you think what we will do here? Our p value is coming less than 0.05. So it means that in our study our mistake is very less mistake, very less error. P value is a mistake, p value is a error. So our study has very less mistake. It means our study is significant. So we will accept study result. That means only option A and option C can be correct. Can you tell which one is better, correct, A or C? Because when a study has very less mistake, we accept the result, and if we accept the study result, then we reject null hypothesis. Because null hypothesis is saying that study is useless. So we have to reject the null hypothesis, which is saying that study is or the drug is not useful. And because we have proven that our new study, new drug is useful, so we will reject HO. Okay. Uh, what is this p-value? Let's understand it better. Remember this point, whenever p-value is less than or equal to 0.05, we accept the result and reject null hypothesis. Okay. Now, let me put one more question. Or before that question, let's have a small discussion of the meaning of p-value. What is this p-value thing? What is the meaning of this p-value? P-value simply means uh, probability of getting a significant result by chance or by mistake. That is p-value. Uh, for example, let's say suppose you are in a mall or you are in a classroom and you suddenly found that a girl whom you like is noticing you. Okay, and when you saw that the girl is noticing you, then you also started feeling some butterfly inside. You also started thinking, planning something for the future, and you thought that the girl is looking at you significantly. But it can happen now that this look came just by chance, and you are feeling it significantly unnecessarily, you know? Like in our first day of MBBS, this thing happened with us. There was a girl, Monica, and she was very beautiful and all. But on the first day of MBBS, when we joined MBBS, after coming from the counseling, me and my friend Rahul were fighting that she looked at me, no, she looked at me. We both were thinking that she looked at us significantly. But then we came to know that she was just looking at us by chance. And she not only looked at us, she also looked at other boys. And wherever Monica looked, all the boys had the same effect. They all thought it is significant. But it was just by chance, by mistake. There was no intention of her. Okay. So, similarly, when you look at coronal study, in coronal study, the result said that coronal is significant in treating corona fever. But you all know that result came by mistake, by chance. Actually, coronal is not significant in treating corona fever. It can help you in developing immunity, maybe, but not in treating the fever. Okay? So, in a way, you can see p value is same as alpha error. In alpha error or p value, both of the cases, we are saying that our medicine is significant, when in reality, our medicine came significant just by chance, just by mistake. Okay, so that is p value or alpha error meaning, and they can ask you to identify it out of the various options. Okay, one more way of understanding p value alpha error means they both means false positive. When we say that result is positive and it is not, there is, it is not positive in reality, it is falsely positive, that is p value alpha error. And uh, sometimes they ask this question that which of the following is correct for p value, is correct for alpha error. Okay, option A, p value means uh, result, which of the following is correct for p value. Option A, rejecting null hypothesis even when null hypothesis is true. Option B, accepting null hypothesis even when null hypothesis is false. Option C, uh, rejecting HO even when false. Or option D, accepting HO even when null hypothesis is true. Okay, what is p value, what is correct for p value, they can ask. So one thing is sure, that C and D cannot be the answer, because in C we are rejecting null hypothesis when false. So if you are rejecting some false thing, it is not an error, it is not a mistake. And p value alpha error, both are mistake, both are error. Okay, so C is not an error. Now let's come to option D, accepting null hypothesis when true. So if you are accepting something which is true, that is also not an error, not a mistake. Okay, now सत्य को सत्य कहना कोई गलत बात नहीं है और असत्य को असत्य कहना भी गलत नहीं है. So we are just rejecting what is false, accepting what is true. That is not an error. Now, out of A and B, what is correct for p value or what is correct for alpha error? Because as we said, p value and alpha error have same meaning. So the correct answer will be option A. Rejecting null hypothesis even when null hypothesis is true. That is p value or alpha error. How? Let me explain it to you. Suppose from your group some friend came and auscultated my abdomen. Okay. And after auscultating my abdomen, your friend, suppose Dr. Rahul, Dr. Rahul said after auscultating my abdomen that congratulations, you are pregnant. Give me party. Okay. So what Dr. Rahul is doing here is Dr. Rahul is giving us a false positive result for pregnancy. है ना? He is giving, I am not pregnant in reality. है ना? This is not a significant abdomen. This is just a simple fatty abdomen like many other fatty people. है ना? So in reality, there is no positive thing for pregnancy, but Dr. Rahul gave me a false positive report. Okay. So he is doing alpha error or p value. He is getting a significant pregnancy by mistake. Maybe that was only my bowel sound, grrr, which Dr. Rahul thought that it is sound of a moving fetus, and he took it by chance as a pregnancy. So this is p value, getting a significant pregnancy by chance or false positive pregnancy. Now accept it in this word, option A. In reality, for my pregnancy, in reality, null hypothesis is true. In reality, I am not pregnant. I can show you the urine test report also. I am not pregnant. Okay. So in reality, if I am not pregnant, it means there is nothing significant in my abdomen. Okay. So if there is nothing significant in my abdomen, it means null hypothesis is true. Because null hypothesis say the same thing, that there is nothing significant different from my abdomen as compared to other abdomen. Null hypothesis means null, nothing is significant. Okay, no significant difference. So in reality, null hypothesis is true. But Dr. Rahul came and forcefully said that there is something significant. So when the Dr. Rahul is saying that there is something significant, it means he is rejecting null hypothesis. Whenever we say that the result is significant, we reject null hypothesis. Okay. So HO is true, but HO is forcefully rejecting null hypothesis. Rahul is rejecting null hypothesis and forcefully saying that I am pregnant. Okay. So he is doing alpha error. He is acting over smartly. He is giving false positive report for my pregnancy. Did you understand this point? Did you understand this question? What is happening here? Here, nothing is significant in my abdomen. Null hypothesis is true. But Dr. Rahul rejected HO and forcefully or wrongly said that pregnancy is present. Just because he want a party, so he made me pregnant. Not literally, just in the result. So in reality, null hypothesis is true. I am not pregnant. But Dr. Rahul rejected null hypothesis and forcefully said that pregnancy is present. I am pregnant. So what he is doing is he is rejecting a null hypothesis which is true. That is alpha error. Okay, is it getting cleared, or do you need one more example to understand it? Huh? Should I give you one more example? Okay, let's take one last example because this concept is important. This alpha error and p value means, what does it means? That null hypothesis is true but rejected. Null hypothesis is true but rejected. Okay, this is alpha error. Let me explain this thing. Suppose, let's take second example. Suppose there are twins brother. Both are 4-year age. Twin brother. And they are twin of the from the same zygote. They have suppose equal strength, equal power, equal strength in reality. They have almost equal strength in reality. They both are 4-year age. This one also 4-year and this one is also 4-year. So they have equal strength in reality. It means null hypothesis is true. No two brother is different from each other. And this in this brothers are different from each other, of course. But in this example, the two brothers are not different. They are twin and they are equal in strength. So in this example, null hypothesis is true. Now suppose you came here and or I came here and I want to send one of this kid to buy something for me, and I want him to bring water for me, or I want him to bring cigarette for me. Suppose I will not send him for cigarette, but suppose. So I will come and say that, oh, you are so intelligent, you are so strong, you are more stronger than your brother. Go, bring cigarette for me. So what I am doing here is the null hypothesis is true. The two brothers are equal in strength, but I came and I tried to act over smartly and I rejected null hypothesis and said one as more stronger than other. Okay, I forcefully rejected it and proved that no, one is more stronger than other. So I am rejecting null hypothesis when null hypothesis is true. This is alpha error. This is p value. Rejecting null hypothesis when true. And this is what Baba Ramdev did in coronal study. Actually, this, suppose this is coronal and this is a placebo, are same for COVID fever. Same for treating COVID fever. They have no difference in treating COVID fever. They both cannot treat the corona fever. Okay. So in reality, null hypothesis is true. But the researcher of coronal study, they forcefully said they rejected HO and forcefully said that coronal is better. है ना? They acted over smartly. So that is alpha error, rejecting null hypothesis when true. And if you remember alpha error, remembering beta error will be very easy. Alpha error is rejecting null hypothesis when true. So beta error will be accepting null hypothesis when false. Okay. So this is alpha error, rejecting HO when true. Now let's take an example of beta error also. Suppose some other friend, let's say Dr. Neha, is auscultating my batchmate Sarika Pallepu. Okay. Sarika was my batchmate in AIMS New Delhi, and she is pregnant right now, suppose. Okay. And there's nothing to do with me, and she had a boyfriend when she joined her PG. We were just good friends, and she is in West Bengal. She is, I think, professor there, associate professor now. So, in reality, Sarika is pregnant. So, if a female is pregnant, it means null hypothesis is false because there is something significant. There is some significant pregnancy present. Okay. So significant pregnancy is present already. Null hypothesis is false. Okay. Significant pregnancy is there. Null hypothesis say there is nothing significant. But here we have a significant pregnancy. So it means in this example, null hypothesis is false. In reality, null hypothesis is false. You are not pregnant. It is just pseudocyesis. You are feeling like pregnant. Okay. So null hypothesis is false. But what Dr. Neha did was she accepted null hypothesis. She accepted that there is no significant pregnancy. So here, the doctor is acting foolishly. Here, in the second example, the doctor is giving false negative report for pregnancy. है ना? They are giving false negative report for pregnancy. They are acting foolishly, or they are doing beta error. Beta error means null hypothesis is false, but you still accepted null hypothesis. Okay. Null hypothesis is false. There is a pregnancy. Okay. So these are the simple example by which we can understand these two statements, that whenever we say p-value or alpha error, it means rejecting null hypothesis when null hypothesis is true. Just remember that. And whenever we say beta error means option B, accepting null hypothesis when HO is false. So please remember, for alpha error, it is my pregnancy example, and it is saying rejecting null hypothesis when true. Remember one line, and you will remember the line for beta error by yourself. Remember the line for alpha error. Rejecting HO when true. That is correct for alpha error. That is correct for p-value. Rejecting null hypothesis when null hypothesis is true. Okay. Chalo. Now, let's do some more question on this topic, and let's try to understand alpha beta error better. Okay. So let's do some more question on this topic. Okay. Whenever, remember this very important point, whenever they ask question from p-value alpha error, they always have this mm, the concept that p-value and alpha error both means acting over smartly, both means saying wrong thing as correct. Okay, this is uh, okay. Let's have this question. Suppose question. Let's read the question number 1. In question number 1, they are asking that what is the correct line for null hypothesis? What is the null hypothesis means? Which option A, B, C, D are here? Which one is correct for null hypothesis? Okay. So option A saying assumption that the study design is adequate. That is not null hypothesis. Null hypothesis talk nothing about study design. Option B is saying that the probability that the relationship being studied is the result of random factor. That is what null hypothesis is. Null hypothesis means that there is no difference between the two drugs, and if any difference is found, it is due to random factor. So line B is for null hypothesis. Line B is correct for null hypothesis. Okay. Then we can have some more question. We can practice some more question. Let's do it by writing it here because it's not coming so clear when I'm projecting it. So a question can be that a scientist proved his new drug to be significant with p-value equal to 0.05. But in reality, the new drug is not significantly different than previous drug. Okay. New drug is not significantly different than previous drug. So they are not different, but scientist has forcefully proven that it is different. So what does this represent? This type of finding, what is it? Option A, is it type 1 error? Okay. Is it option B, type 2 error? Is it option C, confidence of study? Or is it option D, power of study? Which is correct for this paragraph? Because what is type 1 error? Type 1 error is the probability of doing alpha error. So you can say type 1 error is same as alpha error. And type 2 error is the probability of doing beta error. So you can say type 2 error is same as beta error. Okay. So this statement over here is correct for which of the following? A, B, C, D. Try to give your answer. And no answer is wrong, remember. So don't think whether your answer is right or wrong, just give it. So what is happening here? Let's try to understand it. Here, this scientist is saying that new drug is good, my drug is better. But we always have to focus on reality, and the reality is that the new drug is not different. New drug is same. So new drug, you can say new drug is useless. It is same as previous drug. It is useless. but the researcher is forcefully proving that no, my new drug is significant, it's better. Okay, it is useless, but forcefully proved that it is better. So this is an example of type 1 error, where the researcher is forcefully proving a useless drug is forcefully proved to be significant. Okay, forcefully significant. They are forcefully saying that coronel is good in treating corona fever, or new drug is significant, forcefully significant drug, but it is useless drug in reality. So here the scientist, the researcher is trying to act over smartly, and he is doing alpha error, type 1 error. And he is forcefully proving the result or drug as significant when it is useless. Okay. Now let's when we talk about confidence of study, this is equal to 1 minus alpha error. How much confidence you have on your friend, कितना भरोसा है आपको आपके दोस्त पर. The confidence which you have on your friend is inversely proportional to how much lie your friend say. जितना आपका दोस्त फेंकेगा उतना ही कम आपको उस पर कॉन्फिडेंस होगा, है ना. So the confidence is inversely proportional to the lie your friend is saying. So the same thing is for study. Confidence of study means ability to trust, ability to rely or trust on result of study. And this ability to trust is of course in a way inversely proportional to the probability of saying significant result as not significant, the probability of saying non-significant wrong thing as significant. This is alpha error. Saying non-significant as significant, saying wrong thing as correct, and I'm not getting a kiss or anything from the date, but saying that it is significant, acting over smartly, saying non-significant date as significant, non-significant coronal as significant, that is alpha error. So the more alpha error will be there, the less will be the confidence. Okay. Now, the next thing is power of study. And power of study is 1 minus beta error. Okay. What is power? Power means ability to say significant result as significant. That is power. Ability to say significant result as significant. For example, if I ask that can you come in top 10,000? So the reality is that in future, if you keep working consistently and if you have trust on yourself, then you all will can come in 10,000. You all have significant memory power, significant capability. But those people who are not underestimating themselves, who have decreased their beta error, they can say that they will come in top 10,000. Okay, their power will be more. They can say themselves significant when they are actually significant. When you all are significant, you all have, I will prove it also, that all of you have equal memory power almost. Because memory does not depend on our genetics or our capability to remember from the past. No, memory is a matter of present moment. If you are interested in present moment, means you will remember it. That means you have good memory. If you are not interested in present moment, you will forget it, and it means you don't have good memory. Let me give you an example. Suppose right now in this clip, all of your hair got erected. You got goosebumps. And I saw you such a movie which gives you goosebumps all over body. And now suppose I met you after 50 years when I am dying on the bed, and I ask it from you, did you remember, my friend, what I showed you 50 years ago? So if you actually were interested in that 2 minutes, if you got the goosebump, you will remember it even after 50 years now. Huh? So why you remember it after 50 years? And if you remember it after 50 years, it means you have a good memory. So you remember it after 50 years also because you were interested in that moment. You got the goosebump in the present moment. Okay? Moment. For example, there are many students who are preparing for the exam. But out of those students, almost 50% are thinking continuously about their family problem, about their breakup, about their love issue, about their financial conditions, about their future, about their past. They are not in the moment. They are not interested in the moment. They are not focused. They are worried because of something. And because their interest is not in the present moment, so they are not able to remember it. Okay? If you develop the interest, you will remember it, and you can definitely come in top 10,000. Have faith on yourself. Have belief that your brain power, your memory is similar to the memory of Einstein. Actually, there is no difference between your memory and the memory of Einstein. They both are same. It's all your interest that differ, and you can develop interest any day. So it means your memory can improve any day, and you can be in the top 10,000. Okay. So how you can develop this confidence? How you can develop this power? By stop underestimating yourself. So beta error means underestimating the result. When you decrease underestimating yourself, then your power will increase, and all of you can say that yes, I will get the top 10,000. I will be significant because all of you are actually significant. All of you are actually powerful. It's just that you underestimate yourself. Okay. So this is what power means, 1 minus beta error. Underestimating the result, or saying significant as non-significant. This is beta error. Okay. And for example, my batchmate Sarika, whom I talked about, she was a very intelligent and very sincere girl. She used to do all her work on time and remember everything, every concept being taught in the class or discussed anywhere. So during my whole PG time in AIMS, I used to think that I am less intelligent than Sarika. But then when I started teaching you, I realized that I was doing beta error. I was underestimating myself. But in reality, my memory was same as Sarika. I was not less intelligent. I was just underestimating myself. Okay. So please understand and remember this concept, that whenever you underestimate yourself as compared to other people, you are doing beta error. And whenever you are overestimating yourself as compared to other, you are doing alpha error. If you think that I need not to study 8 hours per day, just 1 hour of study is sufficient. My brain power is supernatural. 1 hour I will study, or once a week I will study, and I will clear it. So it's a good thing, but it may be that you are overestimating yourself. Don't do that. Please be consistent in your hard work. And if you are not overestimating yourself, you are reducing your alpha error, then you can be more confident on yourself. Okay. So overestimating is alpha error, underestimating beta error, and power is 1 minus beta error. Now, the real question is, how can we make it sure that we come in top 10,000? How can we increase both our alpha power and confidence? What is the method to increase power and confidence of study? Okay. So, to increase power, remember, we have to decrease beta error, we have to stop underestimating ourselves, and to increase confidence, we have to decrease alpha error. Sorry, that we already know from above. But there are two more points. To increase power and confidence, we can increase our sample size. And second thing is, we have to increase the association. For example, when I was in my internship, when I started my internship, I was not confident whether I will be able to get I will be able to get AIMS New Delhi or not, whether I will be in the top 2000 or not. Because in our time, uh, the PG seats, if you are not in top 3 4,000, like 4,000 5,000, it means, and that was less PG seats was there, and AIMS colleges, only AIMS New Delhi had the counseling for PG seat. I'm talking about year 2012 when I was giving PG. When I started my preparation, I was in internship at that time. So I was also not confident, not powerful. And in that time, my gynae attendance was short, so I was not allowed to give gynae exam for 3 months. And I went to my hometown, uh, where my father asked me that, my son, when you will come back after 3 months, will you be able to tell me every question from last 10-year AIMS exam book? So I said, yes, I can do that. I am not allowed to give gynae exam. I am free for 3 months. And this I did not told to my father. I just told him, yes, I will do that. So, paper. I am telling you a method, a strategy by which you can make it sure that you will also come in top 10,000. Okay. I'm just sharing what I did and what all the toppers usually do, and the method by which you can be sure. So I started doing one previous year exam question paper each day. Okay, because in that previous year there are 200 question, and if you are doing 200 question each day, it will take you around 5 to 6 hours. But if you have done your internship, you have 5 to 6 hour time to do 200 question, and during internship also many posting are easy, so you can do this in 5 to 6 hours. When you are doing previous 200 question, for the first time you can see the answer and do it. But when you are doing it in the second time, okay, always write 10 questions together. 10 answers you have to write together. And after writing 10 answers, check it. Check after solving 10 question. Okay. Because these days I am finding a similar issue from most of my friends and students. They all say that in the exam they get confused between two options. They know the theory, they can tell everything from the notebook which are there, but they are confused between two options. So why this confusion is there during exam time? Because they have not practiced enough objective question. They have uh, they have not practiced previous year, not practiced previous year question by recalling. They have not practiced this recalling thing. And in exam, they do not test our intelligence or smartness or how much memory or knowledge we have. They only test recalling in every exam. Tested in every exam, only one thing we test: recalling. During exam pressure, can you recall the things which you have read from your memory? Can you recall and take it right? So if you are checking after solving 10 question, then you will not try to guess. Suppose you get 4 out of 10 when you did it for the first time. So when you get 4 out of 10, you will try to recall more stronger the next time. And you will not guess answer. And suppose next time you got 6 out of 10, you can see the result yourself and you will be more happy. So this recalling will be practiced if you are doing 10-10 question and checking it. Okay. And you can also give yourself negative marking. If you have done it one time, then on the second time you can give yourself some negative marking also, so that you do not guess any question. So by this way, you will have to practice the question from your previous year books. That's the best idea. And you have to circle all guessed answer and all wrong answer in book. So suppose you are doing question number 3 and 6 wrong, you will circle it, and this circle question should be revised after, let's say, 3 to 5 days. After some day of doing that question, you will revise all those which you did wrong or which is correct by your guess. So if you are doing this thing, you are doing 10-10 question and practicing this recalling, and you are revising all the mistake, it means with this two-step recalling and revision, now you will be confident on all the previous year questions of last 10 year. And solving 10-year question is not a big thing, because 10 year of NEET means if you are doing one paper per day, 10 day. 10 year of INICT is 20 day. So total what I want is only 30 day. In 30 day, you can able to do 10-year previous year question. If you are unable to give this much of time, then at least do 7 year. But do 7-year previous year question. And if you did 7-year previous year question, I can tell you this thing with certainty that 80% exam question topic are same from previous year. Topics are same. If you do previous year, you know what are the topics from which question are coming, and you will be strong in that topic and you will score very well, very high. Plus, in any exam, 40% question, even if they are practical question, 40% question are repeated from previous year. And this is something which all of the good ranking seniors will tell you. So always do not underestimate the power of previous year and revise it like this, because if you did 7 previous year question in next 20 days or so, your exam result will improve by around 15%. Whatever your exam result right now, suppose right now you are getting just 20 day of 7-year question. If you did 20-25 day, your 15% exam result will improve. I can guarantee it. You can try it. You will also find that it is 15% improved. Okay. So I did what my father has asked me to do. I did previous 10-year AIMS question in this manner. And after doing previous 10-year question, when I was about to come back to Aligarh, I suddenly came to know on the phone when I was about to come to my father, and after 3 months to meet him, I came there and I came to know that the girlfriend with which I was in affair for last 2.5 years, she got engaged. Okay, so I was completely like in a shock. You know, I first went to eat an ice cream and to cool myself to think what is happening because I never expected she will marry someone else. And then I tried to call her, and then she said that she decided to go with the family because we are of different caste. So she can't go against family, and she decided to marry with that guy. And I started suffering from anxiety, palpitation, all those issues. It seems like something will come out from here, but nothing comes out. And for 3 4 months, I was in anxiety, and I stopped reading at all because I thought if people have to marry according to caste and all, why I am doing the hard work and I will not study. I will not do anything what world is telling me to do. Okay. And then I called my younger sister, my friend. They were preparing for MSc exam and CA exam to stay with me to help me during my uh, breakup. None of them cleared their exam. Neither my sister nor my friend. They also failed. But at least they helped me during my time. And then after 1 year of time, for 1 year I did not study. And after 1 year, this I came to Delhi and I became normal a bit. And Delhi gave you multiple options. You become a bit normal. So after 1 year, in March, I started once again to revise this previous year question properly. And at that time, there was the previous 2 year question book from DAMS used to come. I revised that book also thoroughly. So with I just revised all previous year questions properly, and I had done one medicine objective book also. And with this much of previous year question bank command, when I gave my AIMS exam in 2012 May, I got 825 rank, and I decided to took PSM. And I'm very happy with my decision. PSM is a branch which actually suits me, and I'm really happy with that decision. So, why I am telling you this story? Because I want you to understand the importance of previous year, and I want you to realize that breakups and issues of family, these all are temporary. These all will go away after some time. Every issue will be sorted. So don't take any issue so seriously because they are temporary. Okay, and do not forget to revise properly previous 7 year questions, because I have seen again and again that the students are only doing previous 3 year question and they are finding it difficult in the exam to solve among multiple options, and they get confused in two option again and again. So why solving previous year will give you the rank within 10,000? Because you are increasing the sample size. If you are solving one previous year, practicing it, and every time you are getting 60 70% marks, then you will be more powerful and more confident on your preparation. This increasing question will give you the confidence. I remember in that 3 month time, gradually my score improved from 7 or 8 out of 10 in just previous year question when I was doing. So I was becoming confident when every 7 out of 10 I was getting correct. It means my performance was improving a lot. And so by this way, when you will do 10 question again and again, you will increase your sample size and your confidence will increase. The second thing is association. The previous exam question is the one thing which is associated with your real exam question. Because if I am the exam setter, from where I will take the question for your exam? Will I take the subscription of Marrow or Prep or eGurukul to prepare question? No, not at all. I will ask my juniors to prepare questions, or I will take some previous year book and I will take question from that, or I will go to online results and I will search from there. So the previous year question is the one from which mostly questions are taken for next year also. That is why previous year is associated with your real exam question. 40% are repeated and 80% topics are repeated. Okay. So if you do previous year properly, your power and confidence both will increase, and I am very sure you will come in top 10,000. Okay. Now let's take one more study example to understand it. And suppose Dr. Arman, who found a new drug to treat obesity of people like me, gave his new drug to 2,000 obese people, and all the 2,000 got cured from obesity. Within 6 months, their body weight came below 70 kg. So if 2,000 people are getting treated, it means the sample size is very large, and it means you can be confident and powerful on this new drug of Dr. Arman. Okay. And suppose every time Dr. Arman give his new drug to treat obesity, and if anyone take it, within 3 months of taking it regularly, body weight in every patient, 2,000 patient, decreased by 10% in 3 months of taking drug. So when you take drug for 3 months, 10% body weight is decreasing. It means drug and loss of body weight have an association. And there is an association. That's why every time everyone is taking it and decreasing 10% body weight. So if there is association and it is given to 2,000 people, now we can be more confident on Dr. Arman and the obesity drug. And we can be more confident. So remember, to increase power and confidence, we have to increase the sample size and we have to increase the association. Okay. So these are the various small thing topics which we have to know in biostat this part. And I know I took a bit extra time to explain how I got in there and how you can be there. But I took this extra time because I want all of you to stop wasting time and stop repeating it. And I want you to clear in this attempt only. So I took this time to explain it. And I am very sure if you will do previous 7 year properly, your exam marks will increase by 15% and you can come in top 10,000. So don't ignore this advice, please. Now, second topic which we will discuss is different type of parametric and non-parametric tests which we apply. And to understand this parametric and non-parametric test, first we should have a basic understanding of what are quantitative data and what are qualitative data. And we all think that we know it, but still we do silly mistake in this. For example, if I ask number of let's say beard student in a class, and how many of you are following Allu Arjun, and how many of you not following Allu Arjun? Maybe Allu Arjun has followed you, and maybe your beard style is original. But I want to know what is the number of beard student in class. So tell me, this will be a quantitative data or a qualitative data? Which side will it go? Quantitative or qualitative? What do you think? This data, because this number word is used here, so due to this number word, you will think that this is a quantitative data. Number is used here. But beard is something which is either present or absent. You cannot look at a person and say that this man has 2.4 beard or 1.6 beard. You cannot measure it. You can only say this man has good beard or bad beard, or the beard is present or absent. So you can only divide beard into category, and that is qualitative data, because the other name of qualitative data is categorical data. Okay, you are dividing it into two categories. So similarly, this number of beer data is a qualitative data, because we can divide it into category. Okay, and the second reason is that this qualitative or categorical data, it is expressed in percentage or proportion. Whenever the data is in percentage or proportion, that is qualitative data. For example, in the class I found that 20 students are beard out of 100 total students. So 20 by 100 is coming in proportion. And if you multiply it by 100, it will come 20%. So this beard, number of students with beard, is a qualitative data. Similarly, if I ask number of hypertensive patient, so hypertension is either present or absent. Hypertension is present or absent. It means it is a categorical data. Okay, qualitative data. But if I say BP, that is a quantitative data. If I say number of hair we can count, that will be quantitative data. If I say weight we can measure, so it is quantitative. But if I say number of obese student in this class, obese student is something, obesity is something which is present or absent. You cannot come to me and say that I am 1.9 obese. You cannot say it. So obesity is present absent. We cannot measure it. It is categorical. But weight is quantitative. Similarly, blood sugar is quantitative. Number of diabetic is qualitative. Hemoglobin of the group is quantitative. But number of anemic female will be qualitative. Okay. So this is one very important concept. By seeing this number word, do not think it is quantitative. If we can measure it, only then it is quantitative. If we can only divide it into category, then it is qualitative. Okay. For example, let's say I said all these things: BP, weight, blood sugar, HB, or let's say temperature. These all are quantitative data. Okay. Now, remember that quantitative data are those data which are expressed in mean. Data in mean. Mean means average or standard deviation. Okay. So if data is in average or standard deviation, it is quantitative. If the data is categorical in percentage, that is qualitative. Okay. Now, after understanding this basic difference between quantitative and qualitative, now we will learn that what are the three steps to decide which test is needed to compare uh, data given in question. Okay, because in our first step we discussed that in the four step of study, After collecting data by cohort or case control, we apply chi-square, paired, unpaired test, all those test, parametric, non-parametric test. And by applying test, we get the result in terms of p-value, confidence interval, and mean relative risk. So, in which condition we will apply which test, that we are going to study, and that they ask in the exam. So the first step is you will look into the question and you will see that are they using pre, post, before, after word in the question. If pre, post, and before and after giving drug result have to be compared, we apply paired t-test. So this is very simple. If you find these words given in the question, pre-post is given in the question, or before and after giving drug word is given in the question, you will apply paired t-test. Okay? Now, this word you have to give attention, pre-post, before and after giving drug word. Sometime they also use the word match data, pre-post, before and after giving drug, or matched data is used in question, apply pair t-test. What do you mean by match data? Now, this is the third word, match data, pre, before and after, pre, post, and match data. Match data means the two group of participants are similar, matched. For example, if you have taken young participant or young patient between 30 to 32 year, suppose you are comparing the effect of OCP. So you have taken young female between 30 to 32 year who take OCP, and you have also taken young patient between 30 to 32 year who don't take OCP. Okay. So here the two group are matched. They are similar according to their age group. 30 to 32 here, 30 to 32 here. So this type of data is match data. Match data means similar to each other. And for example, you are giving a new drug to dilate my pupil in right eye, and you are comparing it with some other drug given on my left eye. So right and left eye is of the same person, same patient. So this is a match data. Match data means the two group are similar, comparable. That is match data. So in any question, if they use before, after, pre, post, or match data, we will apply paired t-test. Okay. Suppose they ask study is done on husband and wife. So husband and wife is living in the same socio-economic condition and in the same house. So their many factors are matched. So that is also match data. One example. Okay. So remember this thing: match, pre, post, before, after, paired. Now, the second step is if we are applying a test on qualitative data. If qualitative data is used, data is given in question, then is to be compared in question. If qualitative data is given in question as outcome, to be compared, we apply chi-square test. है ना? Chi-square is also known as chi-square. When I went to I used to call it chi-square. People told me it is chi-square. I said I will say it chi-square. And what will you will do? And I will do say it chi-square. So the main thing is you should have a qualitative data to apply chi-square test. For example, if they ask effect of a new drug on number of hypertensive patient, number of anemic patient, okay, number of heart attack. So heart attack is something which is present or absent. You cannot say that this man has 2.9 heart attack. You can only say he have a severe heart attack or mild heart attack. So you are just dividing it into categories, severe and mild. So these all data, these type of data are qualitative data or categorical data. And if you have qualitative or categorical data, no matter how many groups are there, we will apply chi-square test directly. Okay. So this is the second step. First, you will look, are they using pre, post, before, after match word in the question? Second, which data is there? If it is qualitative, chi-square test. The third and last step is that if data is quantitative, suppose they are asking mean blood sugar and a mean BP of the group, mean blood sugar of the group, mean BP, HB, blood sugar, weight, and these pulse of SpO2, all of these we can measure, quantitative data. So if data is quantitative, we see how many groups are there. If there is two group of participant among which we have to compare the data, for two group of participant we will apply unpaired t-test. And unpaired t-test is also known as student t-test. And this is also known as independent t-test. Okay. So why they call it unpaired or independent? Because here we have two groups. Remember when we were doing paired t-test, the data was coming from pre-post result. So it means, suppose there are a group of 100 people on which we give some drug to decrease their BP, and we compare the BP before and after on the same group of participant. What is the before result with the after? So this before and after is on the same group of people. That means it is dependent on the same group before and after. It is paired because it is coming from the same group of participants. And now there are two group of participants. So it is unpaired, independent from which data is coming. Okay. Is it clear? Because there are two groups, so it is unpaired. And why they call it a student? I was very happy when I heard this student t-test. I thought very good. At least something is on the name of a student. But then I came to know that a student is the name of the scientist who find this drug. And what a strange name. Suppose someone has a name teacher in the class. It will be fun to throw him out from the class. Teacher, go away. Teacher, Murgaban. Anyway. So this is two group of participant where we apply quantitative data. Two group we will apply unpaired t-test. Now, if there is three or more than three group of participant, we will apply ANOVA. And ANOVA is also known as analysis of variance. Okay, so this is the full form of ANOVA only. So if there is quantitative data 3 or more group, we will apply ANOVA. Quantitative data of 2 group, we will apply unpaired to t-test. Qualitative data chi-square, pre-post, before after paired t-test. Okay, so this is the simple concept by which we decide these 4 type of tests. Okay, let's solve some question on this pattern and then we will take the break. And after the break, we will discuss the difference between parametric, non-parametric, and we will discuss uh, about some other test like jet test, one-way ANOVA, two-way ANOVA, one-tail t-test, two-tail t-test, and a crucial Wallace, Friedman test, Wilcoxon rank sign test, and all those things. We will discuss after the break. But let's discuss this thing: how to decide which test to apply. Because in 95% time, they ask question from these 4 tests only: paired, unpaired, chi-square, ANOVA. So you have to know when to apply which test. Let's do this question. Question 1. Effect of a new drug on uh, on BP of 2 group of participant can be compared by. Simple question, but came in AIMS exam some 3.5 years back. Option A, is it paired t-test? Option B, is it chi-square test? Option C, is it unpaired t-test? Or option D, is it ANOVA? So first thing, there is 2 group. So for 2 group, we never apply ANOVA. ANOVA is for 3 or more groups. So ANOVA is out of question. Second thing, in the question, we are not measuring the BP before and after. So because before and after pre-post word are not used, so paired is also out of question. Now, what we are measuring here? We are measuring BP. And BP is a quantity. It is a quantitative data. We can have BP 120, 121, 122. BP is not in category. Category is hypertension present, hypertension absent. This is quantitative data. And because it is quantitative data of 2 group, so the answer will be unpaired t-test. Okay. Now, suppose I change this question and I am asking effect of a new drug on number of anemic female among 2 group of participant. One taking new drug and other group participant not taking new drug can be compared by. How will you compare it? Can be compared by. So this time also they are comparing a new drug and the same 4 options are there: paired, unpaired, chi-square, ANOVA, the same 4 options. So this time when they are comparing the new drug, you can see that they are comparing it on number of anemic female. And any female with anemia, anemia is something which will be present or absent. Either the female is anemic or non-anemic. So here the data is coming in categorical data is there. Plus, number of anemic female can be, let's say, 40 out of 100 are anemic after getting treatment. Before treatment, 80 were anemic. After treatment, 40 are anemic. So they are not using the word before after. They are only saying how many are anemic in the two groups. Suppose it is coming 40 out of 100. So 40 out of 100 is in percentage or proportion. So that means number of anemic female is a categorical or qualitative data. And for qualitative data, which test we apply? Chi-square test. So that will be the answer of this question. Effect of new drug on number of anemic female of two group will be chi-square. Effect of a new drug on BP of two group will be unpaired t-test. Okay. So now let me ask you a final question which actually came in one of the exam. It was a very interesting question. Effect of yoga on number of infected uh, number of infection among intern, JR and SR can be compared by. If you have to compare effect of yoga on number of infection among intern, JR, SR, how can you compare it? Again, they gave the same four option: paired t-test, chi-square test, unpaired t-test, and ANOVA. The same four option which will be there in any of these type of question. But along with this four option, they also gave you a graph. They write here number of infection. Okay, number of infection on this side. And here they draw this plot. Suppose this is the number of infection for JR. In turn, this is the number of infection for JR. And this is the number of infection for SR. And this is intern, this is JR, intern, JR, SR. Okay. So most infection occurred in JR because they were unable to give more time to their life and yoga, and they were busy. They were more, let's say, they are first year JR. Okay. So in this question, what will be the answer? Effect of yoga on number of infection. What do you think? What will be the answer? Paired, chi-square, unpaired, and ANOVA. What do you think? Here, the answer will be definitely. So how to give the answer? First thing is, they are saying intern JRSR. So there are three groups. Three groups means unpaired t-test cannot be correct. This is ruled out because it is correct only for two group quantitative. Second thing is before afterward is not given. So paired t-test is also ruled out. Before, after, pre, post or match data not used, paired is ruled out. So now we are with chi-square and ANOVA. Only two results can be there. Now we have to see whether the data is quantitative or qualitative. And they are using the word number of infection. So number of infection is something which is a qualitative data. Because when a person came with infection to your OPD, you can only say that whether the infection is present or absent. You cannot say that this COVID patient is 1.9 infected, this is 2.8 infected. They all are infected. Their symptom can be mild, moderate, severe. So infection is something which is qualitative. Mild, moderate, severe is categorical. Similarly, infection is also present, absent. So that is category wise divided, categorical. Okay. Number of infection is same as number of anemic female. Suppose in this class, if there are 100 students, I am sure 80 out of 100 are infected in 1 year, are infected in last 1 year. So when I say 80 out of 100 are infected, this is telling us the number of infected student in the class in last 1 year. And it is coming in percentage or proportion. 80 by 100 means 80% or proportion. So the data is in percentage and proportion, and it is qualitative because it can be classified into two categories. So the answer is chi-square test because the data is qualitative. Number of infection is qualitative. And to help you further in this question, they have given this diagram. This is a bar diagram. You can see 3 bar of number of infection. And you will read it. We will discuss it in biostat together. That bar diagram is for qualitative data. So because we are using qualitative data here, which can be divided into category, the answer come in percentage proportion. So because of qualitative data, the answer will be chi-square test. Okay? Because number of infection is a qualitative data. Suppose I am asking effect of yoga on CRP level, C-reactive protein level of JR, SR and intern can be compared by. So CRP level is something which we can measure. We can measure the C-reactive protein level. So it can be compared by ANOVA because here we have 3 groups and CRP level we can measure. It is a quantitative data. So we will have ANOVA test in this condition. And if I say effect of yoga on TNF level, tumor necrosis factor level, TNF level in JR and intern only. So again, TNF level we can measure. This is a quantitative data. And there are 2 group JR and intern. So here we will apply unpaired t-test. And if I change this question and I say effect of yoga on CRP level of JR and SR before and after doing yoga. Before and after doing yoga, how much their CRP level is changing. So if I use before and afterward, then in this case we will apply paired t-test. Okay. So the same question can be changed into 4 different language and they can ask 4 things from there. If they ask before and after paired t-test, if they ask TNF level on 2 group, unpaired t-test. If they ask TNF or CRP level on 3 group, we will apply ANOVA. And if they ask number of infection in 3 group, because number of infection is qualitative, so we will apply chi-square test. Okay, I hope this 4 type of test is clear to all of you. Let's take a break here of around 20 minutes, and after the break we will come back and discuss about parametric and non-parametric test, Friedman, Crocel-Wallace test, one-way ANOVA, two-way ANOVA, all of those. And then we will discuss about 95% confidence interval and mean relative risk. And we will try to know how to decide which study is more significant, which study is acting as positive factor. Okay, we will try to discuss the concept of confidence interval, parametric, non-parametric test after the break. Okay, so I hope you enjoyed the session, please feel free to post your doubt in the group which is there. And if you do not want to discuss it publicly, you can ask the question from me personally on my WhatsApp number or my email ID, which is docashwani23 at the rate of gmail.com. But it's good if you discuss it in the group, because then other friend will also be benefited from the discussion. Okay. And remember, the email ID is doc, not dog, and it is docashwani23 at the rate of gmail.com. So let's take a break for 20 minutes. Class will restart at it's 12:26, so let's restart at 12:45, and then we will have class till 2. At 2:15 we will take a lunch break. Okay, bye bye. Thank you so much for listening. Bye bye.